have a master's in health. I work in skilled nursing facilities, one of which is just a regular skilled nursing facility, and the other is associated with a hospital. Well, the patients that I've seen all have pretty bad oral health unless they have just arrived. So if it is someone who has just been admitted to a nursing home and they've been cared for at home before, they may or may not have good oral care at all. And those that I have come into the nursing home and taken over, the nursing home care has not been adequate in terms of oral care. So their oral care is really pretty bad. In an office, you have occasionally people who are first-time patients to your office, but most of the patients are maintenance patients, and they're in pretty good health. So these people are all in terribly good health. So the nice part of that is you see big changes in their oral health after taking care of them. Also, one of the biggest obstacles is that you cannot put them in a dental chair and have really good access to their mouth. So you have to adapt yourself to that. You have to be very strong. You have to have strong back and stomach muscles in order to keep yourself from getting hurt. So those are the main differences, I think. Help from nurses that help me, and then of course the administrative staff helps me implement the entire program. They provide the framework for that, and give me the go-ahead to make suggestions and improvements and things like that. So I certainly am not doing it alone. And then, of course, I also work with a dentist who helps follow up on those cases that can't be taken care of in the community or in situations that I can't take care of. Really, I determine before I leave what patients need to be seen on a 3-month basis. And then I can't always see that patient because maybe they're indisposed in some way. They may not be there, whatever. But I usually have enough patients to see 4 or 5 patients a day. That's really all that I can physically do. My patients are all either in bed, laying flat, or they're in wheelchairs requiring me to bend over. And there's no way that I can really adapt my patient to appropriate dental type of procedure that you would have in the office. So I see 4 or 5 patients, and then I go home and do the paperwork. But I do whatever is necessary for the patient. It also might mean communicating with the dentist and or the nurse or the administration, because they may need to be hooked up with some dental services out in the community. So all of that takes pretty much a full day. I think the most thing that is impacting me right now is what happened just the other day, and that was that I do work in a hospital, and I try to be sure that according to the law that people are evaluated, their oral health is evaluated as soon as possible. So I did go around the hospital last week and noticed that someone had been admitted that had not been evaluated and had all kinds of stuff in their throat, hanging down their throat and in their mouth. And you would think that they would have noticed that, but that is part of the access problem, is that people, even if they potentially have some access, somebody has to acknowledge that and get the care there. So I was able to alert the staff that this person had a potential big problem, and then of course they didn't know how to deal with it, so we just got in there and took all that mucus out. But he could have had aspiration pneumonia or maybe choked. I don't know. I would hope that they would find another one of me. The nice thing about being an RDHAP is you can establish a personal relationship with a facility and or the people, and hopefully limit your population so that you can really do a good job as opposed to seeing as many people as possible. I would hope that somebody like myself would care enough to take on my facility so they wouldn't be left in a lurch, because if I'm not there, they really don't have anybody to provide continuing care, which I think is extremely important in terms of maintaining dental health. The people, of course. The patients are great, even though some of them are unconscious, because you actually, when you're cleaning somebody's teeth that is unconscious, you can tell that they are feeling better. They can express it somehow, so they're not really as, I don't think, as vegetative as it might appear. But also, it's really fun for a dental hygienist who's been used to dealing only with the dental community to broaden their scope and look at oral health as a part of total health, and work with respiratory therapists, the physicians, the nurses, the occupational therapists. It makes you feel a part of a bigger team, so you feel like you're doing a better job. Oh gosh, everything is a challenge, but I like challenges. So what has been the biggest? I don't think there has been a biggest. It's all been a challenge to kind of overcome the obstacles. It is exciting that to have these obstacles and solve the problems, because I think we're developing a model here. Nobody's really done this before, so the challenges just come one at a time, and then when we overcome those challenges, we go, wahoo! I think the biggest success has been with the hospital that is this skilled nursing facility that is associated with the hospital, because I feel they have a big responsibility to the patient, and I believe one of the goals of nursing is to not let your patients get worse under your care, if you can. So helping them, providing better oral care. Actually, they've been pleased with themselves, and I'm pleased for them. I get very good response from the people who really want to take care of their patients. That's usually the administrators, the professional staff, and they are all very glad that they have a dental team taking care of the patients, because they felt totally inadequate in that area, and they are glad that we're sort of taking that over. So I would say we're making a really big difference in helping people understand that what they do or do not do in terms of these patients is really critical to their oral health, both in terms of their nutrition and the oral health care. There are a lot of aspects of medicine that actually have an impact on oral health, and before we came, they weren't even aware of that. So they're slowly making differences and putting the mouth back into the body.